Good afternoon. This is Bill Peterson, Executive Director of the Iowa State Association of Counties. I just want to thank all of you for joining us on the call this afternoon. We hope you're all well and taking steps to be safe during this time of public health crisis and economic disruption. Today, we're very pleased to have Governor Kim Reynolds and key members of her staff join us to share information with you related to COVID-19 and the role counties should be playing in this crisis. Joining Governor Reynolds will be Joel Anderson, Policy Advisor to the Governor for Economic Recovery, Sarah Reisetter, Deputy Director of the Iowa Department of Public Health, and Kelly Garcia, Director of the Iowa Department of Human Services. Before we get started with our guests, I just want to make a couple of announcements. First of all, this call that we're on is being recorded and should be available on the ISAC website later today. You can also find on the website last week's call with White House IGA Director Doug Holscher, Senator Joni Ernst, and Congresswoman Cindy Axne, and the webinar we had last week on changes to FMLA, sick leave, and unemployment. In addition to those recordings, there are many other COVID-related resources that we're providing to you as members, and you can find all of those at our website at iowacounties.org. If you'd like to receive updates, direct updates of when we post things to the website, you can send a request to support.iowacounties.org and be added to our newly developed Basecamp site that will give you up-to-date information. So please feel free to reach out. And finally, all the participants on this call today, except the panelists, are muted. So we've allotted time for each speaker to make comments and then time to respond to questions afterwards. We've received several questions in advance, but if you wish to submit questions during the webinar, please follow directions on your screen and send them to rbennett@iowacounties.org. Any questions that we can't answer today, we will follow up with you in the next few days as we are able to get those answers for you. Now let's get started. So first of all, I want to thank Governor Reynolds for joining us today. Governor, I have to say, you picked one of the most difficult times in our history, in the history of our state, to be governor. And on behalf of our members, I want to thank you for your tremendous service. I know the decisions that you make every day have life and death consequences, and it takes a tremendous amount of courage to do your job in this time. So thank you for being here and being willing to serve. So Governor Reynolds, would you like to make some comments?
Oh, thanks, Bill, and it's good to talk to you, and thanks for giving me the opportunity to speak with supervisors across the state. And I also want to thank each of you for your leadership in this really difficult and unprecedented time. You know, I spent 19 years in local government at the county level, and so I understand how important what you do on a day in and day out basis with counties all across the state. So thank you. Hey, I'm just going to give a real quick update on the numbers and then kind of an overview of this week, and then I'll open it up for questions. But today we had announced 191 new positive cases. So we have a total of 2,332 positive cases. We haven't had any new counties for the last couple days, so we're still at 82 total counties that have had a positive. We've had total negatives of 19,460. We have tested 21,792. So 1 out of 143 Iowans have been tested, so those numbers continue to get better. We have 1,007 Iowans that have recovered for a recovery rate of 43%. It's been a difficult week in Iowa, but there are some positive things that are happening that I think will help enable us to move forward. We have significantly increased our testing capacity, which allows us to track virus activity and identify potential risk, and that's just critical as we identify the hot spots. And it's also critical when we talk about reopening the state. It'll allow us to, again, target specific measures to slow the spread, whether that's in a business or a community, and it will help us make informed decisions as we begin to reopen the state. So really helps us really focus on where we need to be. So we're taking care of our most vulnerable Iowans, making sure that we're not overwhelming the healthcare system, flattening the curve, and therefore allowing us to open up quicker. Next week, I kind of teased it a little bit this week, we'll be launching Test Iowa. And it is an initiative that will enable us to conduct large-scale testing and, again, contact tracing across the state. It'll allow us to ramp up our capacity to over 3,000 tests a day. And that's on top of what the state hygienic lab is doing. So they're bringing in additional tests all the time. In fact, they have right now, I think, 10,588 at the state hygienic lab. And then we have the testing that's being done at some of our hospitals, and then the national labs that Iowans all have access to. In addition to that, we're preparing to begin serology testing, which we're really excited about that. We have 2 labs in the state that will be able to run those tests, and as soon as the supplies arrive, they're ready to go. And that's the test that will show whether you've had it, COVID-19, and recovered from it. We still don't know. Sarah can talk a little bit more about the immunity of it and how long that is. So there's still some unknown out there, but at least it'll give us a good sense of who's actually had it and recovered for it. The Department of Public Health has activated response teams that are dedicated to testing, contact tracing, and prevention. They've stood up dedicated strike teams that'll be deployed to long-term care facilities and large businesses, especially some of our processing plants where we're seeing some outbreaks occur, or we anticipate that could happen, and so we're trying to get in front of that. The team of nurses, they'll conduct the surveillance testing among the long-term care residents and staff, employees at our large food processing plants and other businesses, all in a manner to help slow the spread of the virus in those environments and help to get some sense of what the scope is or potentially could be. We also significantly are increasing the number of nurses and other healthcare professionals that will be conducting the contact tracing to help augment the work that our local public health officials have been doing. They are just working around the clock to really be a resource in our counties and communities across the state, and to really do that surveillance and contact tracing, which is so important. And finally, then the prevention teams they'll conduct outreach to businesses and law enforcement, again, to review guidance for preventing and detecting outbreaks. It's just about education and what we do if an outbreak is identified. So those are all kind of being stood up right now. We have some that are actively going into some of these communities, and we hope to just continue to kind of build those out and build them up. Yesterday, I did announce that Region 6 had elevated to a level 10. And this is due in large part because of long-term care facility outbreaks, and just really we're seeing increased virus activity occurring in that area of the state. So through April 30th, residents of Region 6 counties are they're prohibited from gathering outside of their own households, and this is done intentionally for 14 days through April 30th, again to help slow the spread of the virus in the communities. And then earlier today, I announced that Iowa schools will not reopen this school year. Districts are going to continue to provide continuous learning opportunities for students until the end of this regular school year. And then districts also will be working on their return to learn plans for when schools do reopen. And Director Lebo and the Education Task Force will be providing guidance in the coming weeks. So difficult decisions, and not ones that, we understand the impact that this has on Iowans, businesses, families, counties, just the way that we normally do business. But, just necessary at this time. We're hopefully we're going to turn the corner. Iowans are buckling down and doing what we've asked them to do. And so as we gather more information, we can then continue to be more targeted, maybe in the areas that we need to continue to apply some of the mitigation efforts that we put in place, and then talk about other areas that may be at a point where they're ready to start to dial back up in a very responsible, phased-in approach so that we don't see a resurgence. So we have to be very thoughtful about how we start to reopen areas of the state. And then just lastly, as I wrap up here, close with some good news that'll help, I think, move Iowa forward. And that's, we had 29,424 Iowa businesses approved for loans through SBA Payment Protection Program, and this will put about $4.35 billion into Iowa's economy, and most importantly, keep thousands of Iowans working. So we ranked in the top 20 of all the states approved for funding, and it was due to the quick response of Iowa banks and credit unions. And additionally, the Iowa Economic Development Authority Small Business Relief Grant has sent 96% of the $24 million to more than 1,200 small businesses in Iowa, which was kind of meant to be some bridge financing until the PPP loans or grants were able to be accessed. So we're hoping to expand that small business relief grant. You're going to get to hear from Joel here in a little bit or ask some questions of him, but we're waiting on guidance from the U.S. Treasury. So we were supposed to have it Monday, then we were supposed to have it Wednesday, and so we still haven't had that. And we really need to understand how we can utilize the dollars that are coming into the state so that we can use the dollars that are coming into the state. So with that, again, thank you for your leadership in counties across the state, and I look forward to working with you to reopen Iowa.
Okay, thank you, Governor. So one of the first questions that our members had related to, as you mentioned, we're starting to see some of the financial assistance begin to arrive in the state of Iowa. Some particularly for, I don't know if Iowa's yet received the state's, the stabilization funds that were part of the CARES Act. But as those dollars come in, our members, I guess, are wondering how you will involve them in making determinations on the best way to get those resources to places that need them. And they just feel it's important to be part of that discussion. Do you have any thoughts on that?
Yeah, a way that we can do that. So as we start to see those stabilization funds come into the state and how we better understand how we can utilize them, I will be implementing an economic recovery task force. And so it'll have different subgroups on how we can stabilize, recover, and grow our economy. And so we would look to local government to be a part of those discussions and how we, what metrics allow us to get through the stabilization period and move into recovery, and what are some of the things that we want to address, and what are some of the metrics that we use to identify that phase of the recovery, and then what are the things that we'll be looking at to not only stabilize, recover, but then how do we grow Iowa beyond where it was when we first started dealing with the coronavirus. So we'll coordinate that. Joel will coordinate that, Bill, maybe through you, if you can give him some ideas of who would be the right people to serve on that.
Okay, thank you. We'd appreciate that opportunity. We've also been working with our congressional delegation promoting additional resources from the federal level beyond the $150 billion that was part of the state stabilization to get resources that would help for loss of revenues, either sales tax and other things. I'm sure you've been reaching out to our Congress folks and senators on the same issue. Do you have any thoughts on that?
Yeah, we've been actually reaching out to our congressional delegation, as well as once a week we get on a call with the Vice President. Oftentimes the President is there. I'll have an opportunity. They're scheduling a call for me to speak with Secretary Mnuchin, hopefully probably first of next week. It doesn't look like that's going to happen today. But we're asking for that in phase 4 to have additional funding go into, or we've asked for some flexibility with the money that's going out to see if we can use that to supplant some of the funds that we've lost from COVID-19. Right now, that's not an option. So, but we continue to ask for both. We continue to ask, and we've got through the National Governors Association, Larry Hogan. Well, first of all, they did a letter. He sent a letter in. It gets brought up on every single call that we're on. Just better understanding, I think, of how we can use the existing funds, more flexibility with that, and then additional funding for some of the lost revenue that the states are experiencing. It would be helpful if they could get the guidelines out so we would have some idea of how we can, so that would be helpful too, and we can start utilizing the money that they've already supposedly, that they'll be apportioning out to states across the country. But there is a constant push. Every single call that I have been on, it's been brought up, and if individual states aren't bringing it up, or if I'm not bringing it up, it's being brought up on behalf of all the governors through the National Governors Association.
Okay, thank you, Governor. So one of the concerns that one of our members in a question expressed was the relationship between the State Department of Health, Emergency Management, and the local public health agencies. And their concern was about having adequate resources to respond to this crisis at the local level. And I guess I know that this has been a difficult challenge to get everybody on the same page, but how is the Department of Public Health working with those local public health agencies and other local emergency management agencies to make sure that they have resources to respond at the local level?
Well, I'm going to let Sarah Reisetter go ahead and take that question. She is the command leader of the incident team, whatever it is, but she's been leading this effort, and I've just been extremely grateful for her hard work and outreach, but I'm going to let her answer that question.
Thank you, Governor. So one of the things that our department has been doing, and we've been doing this routinely for the last, I don't know how long have we been in this, 8 to 10 weeks. We hold a series of weekly webinars where our staff have an opportunity to talk to not only local public health agencies, but emergency medical services providers, as well as hospital leaders within the communities. And, you know, I think that Director Flynn with the Department of Homeland Security, I think that she and her staff also have weekly meetings and calls with their emergency managers. And so I realize that things are moving very quickly, but we do make a concerted effort on a weekly basis to have cold calls and in addition to those calls where we kind of review any guidance that might be updated. I know there's always an opportunity for question and answer period. In addition to that, anytime that the department puts out new guidance, we have what's called a health alert network. And so all of our local public health administrators, as well as staff within their agencies, hospitals, EMS providers, they all have or should have accounts for the health alert network. And so if people have concerns that they're not receiving adequate communication from the health department, I would invite them to reach out to their regional community health consultant. Every local public health agency is assigned a regional community health consultant, and they can certainly help facilitate getting access to the health alert network. And if they need help getting connected to those weekly webinars, those regional community health consultants could certainly help them do that as well.
And then even another piece of that is the Iowa National Guard through the RMCCs, or the Regional Medical Coordination Centers. Is that right?
That's right. That's
okay.
Correct.
Oh, yay.
Yep.
Okay.
You got it.
The National Guard is big in acronyms. But anyway, that's also, they've got LNOs that are helping facilitate some of that too, I think.
That's right. So we have regional medical coordination centers that are set up in all six in all six regions that the governor was mentioning earlier. And the work that's happening within those regional medical coordination centers, it does include members from the Guard to help with planning. It includes local emergency managers, as well as local public health officials in a lot of counties. They're engaging their emergency operations centers and sending staff from those local emergency operations center into those regional medical coordination centers. And those centers are really, the purpose of them is to help with planning, but also to help when resources might become slim or of a concern. They're there to help coordinate the transfer of resources, for example, or to provide advice about regions that might have some capacity to take extra patients and that sort of thing. So that's really what the regional medical coordination centers are set up for, and local public health should be engaged in those as well.
Okay, thank you, Sarah. Governor, thanks for the response to that question. Governor, one other question that came up was county auditors have been working closely with the Secretary of State to make sure that elections continue to run smoothly during this time. I know that we've had a few local elections that were delayed until I believe in July, but with the primary coming up soon, there's a lot of preparation being made for training and facilities. And they were wondering if there could be some proclamation issued allowing access to polling facilities for election use only.
And so we'll be doing that we're kind of clarifying that in a proclamation that'll be going out probably the end of April, because that's probably, I don't know, we do them about every week, I think. So there will be an opportunity. But the short answer is yes. We'll be clarifying that. We don't see any, so yep, we're working on it.
Okay, thank you. One other question that came up was that, so I understand that members of your staff will be meeting with several regional mental health CEOs next week to discuss issues related to funding and staffing for some of the new services and other challenges that the regions and counties are having implementing some of the new programs. Are you aware of those challenges? And maybe you could comment briefly, I think, to our members about what steps you think should be taken. Obviously, with the challenges regarding this pandemic, mental health and other related services are really critical.
Yeah, yes, and we are aware of that, and we are also aware of the fact of the additional resources that potentially could be required with the pandemic. So one of the federal disaster proclamations that I submitted, we've asked for individual assistance that would allow us to provide additional funding specifically for mental well-being and some of the issues to work on that. And then, want to take it?
Oh yeah, and I was just going to add too, this is Sarah again. I know that our staff at the health department have been working with the Department of Human Services on adding additional resources to promote Your Life Iowa, which is it's a website that's hosted by the Department of Public Health, but it is also in part funded through the Department of Human Services and the mental health regions. And so that Your Life Iowa campaign, I think, is getting set to roll out in the next couple of weeks. Just really focusing on the negative impacts that COVID-19 and self-isolation has, we recognize that has the potential to have some negative impacts on the population. And so that resource is being beefed up to make sure that it can handle the demand that might come. But there's a resource available by phone, by chat, by text message. And I actually just had an opportunity to look at that campaign materials yesterday, and they look really nice. And I think they'll be rolled out within the next couple of weeks.
Okay, that'll be another positive resource. And if we can get the funding that we've asked through the disaster declaration, and then there'll just be additionally, I think, some of the other funding that's coming in that we'll be able to utilize that. But so again, and plus we were just talking through the legislative session about making sure that we could provide, sustainable funding for the mental health programs that we've put in place, whether it be the mental health services, the adult mental health services, or the children's mental health system that we stood up. And so it will continue to be a priority. When I talked to legislators before we suspended the session, everybody is in agreement that they know that this is a priority and it has to be addressed. So, but another way that we could access, some of that conversation and understand the scope and breadth of what it is through the representative that you have on the Economic Recovery Task Force, and Director Garcia will be a big part of that, as well as the Department of Public Health representative on the Economic Task Force as well. So there'll be a couple different ways that we can go at that. I think maybe that's what you were asking too. We're going to continue to understand what, the scope of what it looks like moving forward, and some of these other resources that Sarah was talking about, I think will be really useful in the interim to start to address kind of the gap that we're seeing as people are sheltered at home. And then we'll start capturing what additional needs look like, what the resources are that we have coming in, and what that gap funding needs to look like.
Okay, thank you, Governor. One other question that came in is related to working with the Chief Justice about reopening the court system at some time. Obviously, a number of activities in that area have been pushed back for some time. Are you in contact with the Chief Justice on those issues?
Yeah, my legal counsel, Sam and Michael, are in contact with them on regularly. And so, and any time that we either issue a new proclamation or we come to a time frame where one would be expiring, we are always working to keep them in the loop so that we can kind of be consistent as we move forward with any additional or any cancellations of the proclamation. So we'll be reaching, I mean, he talks to her often, but we'll be reaching out to them as we narrow in on the April 30th deadline that really almost all the proclamations are tied to at this point.
Okay, thank you, Governor. I think that was all the questions we had specifically for you now, and I know that you have to jump off the call here, but before you go, I just want to again thank you for being with us today. We can't thank you enough for being a leader in this challenging time, and we just want you to be safe and take care of yourself.
Thank you. Same to all of you, and thanks for getting on the call and let me be a part of it. I appreciate it. Take care. Bye.
Bye. So Joel Anderson, Policy Advisor to Governor Reynolds for Economic Recovery. Joel, welcome to the call. I guess we'd want to give you a little bit of time just to make some general comments, and then I think we have 3 or 4 questions for you as well.
Yeah, thank you. So one of the things I want to just thank ISAC for was reaching out early on, and particularly on the county recorder and county DHS issue, and urging us to write the letter and working with Jamie and Lucas on that to make sure that real estate transactions keep on flowing and that Iowans keep on getting the services that they need. So thank you to everyone. I've been in contact with a lot of you individually, been reaching out, and I just want to say thank you for all the best practices that you're all doing, especially in the county recorder area, of making appointments to allow for abstractors to come in, to making access to all of the records still, and then do proper sanitation, proper social distancing as well. I'm in constant contact also then with the Division of Banking, Iowa Title Guarantee, and everything too. And we really have not seen that much of a slowdown on real estate transactions because of that. So thank you once again for figuring out how to still let Iowans access these critical services, and redesigning and redeveloping and rethinking how we deliver. I think that's kind of going to be a key thing too for this task force that the governor is putting together, and that stabilize, recover, and grow. Modernization will be a discussion throughout the entire thing of how do we look at delivering these services in a new way, be it either electronically, appointment only, or anything, and really be able to use this time to really rethink and deliver new services and better services to Iowans. So that's kind of what I have, and then I'll let the rest of the time for those questions then, Bill.
Okay, thanks. So Joel, will you be the one that works directly with this economic recovery task force? So, and our question specifically relates to the CARES Act that provides funding for state assistance. There was a provision in that CARES Act that local governments that exceeded 500,000 in population would be able to get resources sent directly to them. But it's my understanding that Iowa doesn't have any, even our largest county doesn't have that population threshold. So when those dollars come down from the feds, how will those be distributed to state agencies and counties to handle those things that the CARES Act envisioned being able to provide additional resources for?
Yeah, so I will be, one of the people on the governor's staff looking at that and working very closely with Dom and then also Department of Revenue on their property tax side too. Just because Iowa does not have any place that is over that 500,000 population does not mean that we are not still going to be committed to disseminating those funds to local governments, county, city, schools, anyone. We know that our delayment of property taxes has put you in a pinch, as well as sales tax being delayed too, which then would have a loss component as well. So the biggest thing is though we do not have guidance yet on how those funds can be used. And really what we want to make sure that happens is that we spend this money in a proper way so that 2 years from now, when we know we're going to get audited again, much like what happened in the 2008 for the ARA, that we can justify everything that we spent and how we spent it. Because we do not want to have an issue where 2 years from now we have to pay back $100 million and try to find that in the budget at that time. So really we are on a holding pattern until then. We do not have that much guidance. All we know is that it should just not be used to plug a budget shortfall that existed prior to the COVID-19 crisis. So that's really the only guidance that we currently have. But as soon as we get that, I will be reaching out to ISAC, that local government component of the task force will have a good influence on that. And then just working with Dom then to figure out how do we deliver that money back out to everyone. Is it through a need-based grant application, through a revolving loan fund, through whatever that the guidance gives us, because once again, we are just committed to making sure that it is spent properly so we don't run into a situation 2 years from now.
Okay, thank you. So I know that I think you've worked with some county treasurers. I think you were the staff member that worked with some county treasurers on the proclamation suspending penalty and interest on delinquent property tax payments beyond April 30th. So I guess our members were wondering if we can expect with the annual tax sale that's scheduled for June 13, is there a plan to extend that interest on delinquent property taxes beyond April 30th? Do you know? Joel?
I think we might have lost the team that's in SEAC. I'm wondering. This is Kelly Garcia, Director of DHS.
Oh, okay.
Hey, Bill, we are back.
Okay.
Sorry about that. I had to cough and I wanted to press mute and I did not press that. So I am sorry. I heard the tax deferral on April 30th and then cut off. I am sorry about that.
Oh, that's okay. We're all struggling to get used to this new means of communication instead of face-to-face, having to have all these devices between us. So anyway, I guess the question was if there was any thought given to extending the current suspension of penalty and interest on delinquent property tax payments beyond April 30th. Because, there is that tax sale coming up, which is scheduled for June 15th. And I know county treasurers are concerned about that process.
Correct. We are at this time still reviewing that. It is not. It is what I want input from all of you still on this, because we also realize we do not want to keep on delaying tax payments, the biggest revenue source for county, cities, schools, on that. And that's also where we've been very clear that it is not a delayment of payment. It is just the delayment of interest and penalties. and have been encouraging everyone to still pay online if they can, mail in if they can. And so that I would really kind of turn it back over to you all to see, do you feel like there should be another delay, especially since now unemployment is flowing, the Paycheck Protection program money is starting to flow, and so some of the federal funds through the CARES Act is coming through. So Iowans do have the ability to pay, but that is really where probably reaching out to you all to see what do you take. The one thing is too is that I have been working with Lucas on your team to get language in there for the tax sale for some of them, and working with the Dickinson County Treasurer on that, and we should hopefully have something here soon regarding that too, so that we don't unintentionally, Iowans that are put into this situation aren't being impacted by something that normally wouldn't have happened if the normal circumstances went through, but just potentially by the luck of everything happening is in the situation. So really that's kind of where our thought is on those tax deferrals right now.
Okay, thank you. So we do have one other question, but I think we'll, because it's time for us to move on to the next panelist, I think we'll, just make sure that Lucas gets to you with that question. And again, it has to do with the tax sale. But Joel, I appreciate you being on the call today and appreciate your service in this difficult time. I'd like now to, now I'd like to move on to Sarah Reisetter, Deputy Director of the Iowa Department of Health. And Sarah, thank you for joining us today. I certainly appreciate you being here. I just want to say, I think you have done an amazing job every day, along with the governor during the press conferences, taking a lot of difficult questions and being very professional in your response. So thank you so much for your service. So would you like to just take a couple of minutes and make some comments, and then we do have a couple of questions for you as well.
Sure. Yeah. Thank you, Bill. And I wanted to take a quick opportunity to say thank you for all my county auditor friends that are on the phone today. I looked through the attendee list and saw some familiar names on there. I have to say that some of the stress of a pandemic, I would take election night result stress anytime over this. So this has certainly been quite an experience for me. But first, I do want to just say a big thank you to you all as well. I know that as business and the way you do your operations, whatever kind of county government you are working in, that things have changed dramatically for you as well. And so I want to start by just saying a quick thank you for everything that you're doing locally within your communities to amplify the public health messaging of stay home and stay healthy. I think that you'll be able to tell through the remarks that I've prepared that Governor Reynolds and I have been spending quite a bit of time together, because she actually said most of the things that I had prepared. But just I wanted to provide just a little bit of an overview of what the Iowa Department of Public Health activities are, the kind of the things that we are supporting here from the State Emergency Operations Center. We are continuing to work with long-term care facilities as well as businesses when positive cases and potential outbreaks are identified. One of the things we talk about a lot in public health, infectious disease investigations, is something called contact tracing. And I know you've heard us talk about that during our daily press conferences as well. And what contact tracing really is it's reaching out to an individual that has been diagnosed with an infectious disease. And this actually is very core public health work that we are used to doing in conjunction with our local public health partners all the time. So we do this with salmonella outbreaks or E. coli outbreaks, any type of infectious organism. When we start to see a cluster of those sorts of cases, we do contact tracing. It's the bread and butter of public health business. And so while we continue to work at the state level with some of these long-term care facilities and businesses, the contact tracing work at this particular point in time has really been turned over to local public health agencies. But as our case counts continue to increase, especially in some of our more rural counties that might not have as much human resource available to do this contact tracing, as you heard the governor say earlier in this conversation, we have started to put together a number of teams here at the state level, and one of them will be a contact tracing team. We're looking to beef up the numbers of people that can help local counties do contact tracing. I know that there are counties that are well equipped to continue to do their own contact tracing, and so our goal isn't necessarily to come in and take over what's going well, but for counties that need additional support in getting that contact tracing done in an efficient manner, we're setting up a team to do that. And we're working to identify some resources that can help us do that contact tracing in languages other than English. As we start to have outbreaks in some of our packing plants and other areas, we understand that those resources will be necessary as well from a health equity perspective. We're also going to have teams to do surveillance testing at long-term care facilities and essential businesses when outbreaks are occurring or when outbreaks are suspected. And so to date, because testing supplies have been limited in Iowa, the testing focus has really been on people who are symptomatic, who are ill, who are hospitalized. And as additional testing resources become available, we're moving to more of a surveillance testing methodology in some of these areas where it's essential workforce, for example, that can't be shut down to maintain food supply, for example, or surveillance testing at long-term care facilities where we know that staff need to continue to care for residents. And so what surveillance testing is it means that we're testing people that might not be symptomatic, but that are in close proximity to people who might be infected or who are symptomatic. So we're putting together a couple of strike teams, one for long-term care facilities and another one for businesses. And so that'll be their mission when they get up and going. In addition to that, we're putting together some prevention teams, and this was work that the state public health department did with long-term care facilities, and we started doing this work in January when we saw the virus starting to start to move across the globe. And the idea behind these prevention teams is to really be proactive and reach out to businesses, especially those sorts of places where telework and social distancing is challenging or staggering shifts. And so we want to reach out to businesses, talk to them about the guidance that the health department has put out, talk to them about the challenges that they might be having in implementing some of that guidance, and seeing if there's other things that we can do to support them as they try to keep the virus out of their workplace and from making their workforce sick. In addition to reaching out to businesses for prevention, I think we are planning to do some work with law enforcement agencies and counties as well, related to county jails and making sure that we can keep the virus out of county jails to the extent possible. If anyone has read the stories about Cook County Jail in Chicago, it's just like a congregate living facility where the virus it is very efficient at spreading in those sorts of settings. So we're still working through the specifics of these support teams, but we anticipate we'll be able to start deploying them next week. We also continue at the health department to work with our partners in the governor's office and labs across the state to increase our testing capacity. And that includes developing plans for serology testing and how that new type of testing can be most effectively deployed. As you heard me mention earlier in response to one of the questions, health department staff are also supporting the work of the regional medical coordination centers in conjunction with the National Guard. And those centers are intended to assist with planning and resource management, both within the 6 regions where they've been established, but across regions as well. We've been working with the hospital systems to understand patient admission and transfer patterns, as well as surge capacity in the event that our healthcare system does become overwhelmed, and what we might do for alternate care sites should that ever become necessary. We do hold weekly webinars, you heard me say this earlier, with long-term care facilities as well. And the goal of those is to provide infection prevention guidance and also to provide information about how to detect and control outbreaks. We hold weekly webinars with healthcare coalitions, and those do include our local public health agency partners, emergency medical services, and hospitals. And then during these calls, we review updated guidance, current data, and review best practices. And so in closing, Bill, before I take questions, I just want to just say one more time, thank you for everything you're all doing. Please stay home when you can, stay safe, and stay healthy.
Okay, thank you, Sarah. One of the questions that we received was, I think the first phase one of funding, there was like, I think $8.3 billion that had some funds for public health financial assistance. Have you started to see any of those funds make their way down to the state of Iowa? I think they were supposed to be out within 30 days of the passage of that. And how have you been able to use those dollars?
Yeah, so the funding that the health department has received so far is in the lane of preparedness funding. So I think it's really a hospital preparedness funding, and I don't have my spreadsheet in front of me to see what the name of the other one was. So we have received that funding, and I think that we're currently in the process of amending contracts to get those funds out locally. Bill, that would be something I can, because I don't have the details right in front of me now, I'd be happy to follow up with you for distribution to your members about the status of those two funding, those two pools of funding. I know that there were two related to preparedness. I just don't know exactly where we're at in terms of getting them out the door to locals.
Yeah, so one of our members contacted us a few days ago about the fact that they had received some about $6,400, and it was called Health and Human Services Stimulus Dollars. And so we reached out to the White House Office of Intergovernmental Affairs to see if they could help us understand what that money was for, because it was very unclear. And their response back to us was that it were dollars that were really to go to physicians for Medicare related services. And it seems strange that those sorts of dollars would end up in a county auditor's bank account. Do you have any ideas on what that funding would be?
You know, I've pulled up my spreadsheet here as we've been talking. And you said it came from HHS? Yes. Okay. I don't see that here. But is it for small rural hospitals? Is that what you said?
Well, it went to the county auditor. And
it went to the county auditor.
Yeah, so okay. I'm not sure why it wouldn't have gone.
I think I might know.
Okay.
Oh, Kelly, okay, that's great.
Yeah.
Okay, well, Kelly,
and I'm going to have to, I just sent an email to folks. I'm going to have to jump off because I have a call with our federal partners at 2, actually. We're running a little bit behind, but so there were some, and we're still trying to get a handle on this. There are going to be waves of direct payments made by HHS direct to providers. So in this case, I don't know why it went to that particular bank account. That might have been an oversight, but it was a proportionate share respective to Medicare patients. We received a payment too for our state mental health institutions. And so that is likely the reason, but if you want to follow, if that particular county wants to follow up with me directly, we can try to trace it back as well.
Okay, thank you. So,
yeah, and Bill, I just pulled up our spreadsheet. We have preparedness response grants and hospital preparedness program grants that we've received, and so I can provide more information to you about that as well.
Okay, thanks. Well, Sarah, thanks for joining us. Sounds like Director Garcia needs to get in before she has to get off. So we definitely appreciate you joining us today, and please be safe and keep up the good work.
Will do.
Director Garcia, thank you again for joining us today. We really appreciate you and your agency trying to help Iowans in this difficult time. So I do want to give you a few minutes to make any comments, and then we do just have a couple of questions for you.
Absolutely. So I had kind of a longer list to run through. I'm going to highlight just a couple of things so that you have time for questions. I can probably be slightly late signing into the federal call, but I don't want to be too late to, they normally give a little bit of a window. But so we've been working on ensuring that Iowans in need of medical and social assistance have access to those benefits. So I think y'all are probably fully aware of the measures that we've taken to really lift those barriers and ensure that our clients have a stable resource during this time. We appreciate the partnership in continuing to ensure that our income maintenance workers have access to the office so they can meet clients' needs. Unfortunately, our electronic benefit system does not allow us to do that work completely remotely. So we really appreciate the assistance there. We are certainly concerned, and I think you probably heard some of the comments that I made in partnership with Governor Reynolds on Wednesday, respective to our intakes having a steep decline because of the loss of mandatory reporters really seeing children and dependent adults in the typical way that they do. So I would just call on our community partners to really be engaged in that effort. And if you're, concerned of anything at the community level, please do reach out to us. I've had calls with superintendents, and I'm having a call with faith-based leaders next week to really engage those partnerships in kind of new avenues. And we'll continue to make sure that we're having a really open dialogue and arming folks with good, solid questions to engage children and adults and kind of how their day is looking like in this time. I appreciated your question early on to the governor about the MHGS regions. I don't know that I'm engaged in the conversation that you mentioned next week, or at least it hasn't come across my calendar, I don't believe. But that is something that we are absolutely talking about internally. A couple of things beyond what the governor mentioned and Sarah mentioned respective to the response, some of the things that I think we're concerned about, whenever I talk with the CEOs of the regions, I always talk about, the fact that I feel their pain because I also run facilities where we struggle to have providers, and bringing those services, you can't bring those services online if you don't have a solid provider pool. And so I am really eager to engage in that conversation with y'all about what it looks like in real terms. We certainly don't want to backslide and lose the ground that we've made in bringing the children's services online. But we absolutely have to be cognizant of the fact that we're in an odd time and situation. We've lost some of the direct pipelines for providers. And so I've been engaging in some conversations this week about efforts to reinvigorate those pipelines and really try to make up some ground that we've lost. And so I just want to say that I certainly recognize that we're all in this together. We want to be flexible and think about ways that we, like I said, can kind of make up some ground that we might have lost during these couple of months. And so we will stand ready to have those conversations and listen to your concerns. And I think the last thing I would say is that we've been fast and furiously working on our distribution of funds across our system, and embedded in that is childcare. I know that's really important at a local level. We know that that's important at a statewide level because it's the backbone of our economy. Parents can't go back to work if children don't have a place to go. And so we are working to assemble a small group early in the week next week to have a warm response to the plan that we've put together. It'll be for the first wave of funding. We've also been working with Director Durham on the distribution of funding that she has available through her agency and other mechanisms that small businesses can tap into to make sure that they're kind of remain afloat during this time and are able to either stay online or come back online once businesses start to reopen. So with that, I think I've covered everything on my list. If y'all want to ask some questions, I am happy to take them.
Yes, well, we had one question and this is a little bit out of my knowledge base, but I'm going to try and ask this question the right way. So we've had a question about whether or not there's been discussion with federal agencies about extending the use of electronic cards for benefits and the WIC program at suppliers beyond Walmart and Amazon. So I think this.
So I think you're talking about SNAP. I can answer the question.
SNAP,
I know
okay.
you're talking about SNAP, not WIC. WIC is over at Public Health, but and has a different card than we do. But yes, we have, and actually so Iowa is part of a pilot project for our SNAP electronic benefits cards. We're one of 4 states across the nation that has the ability to use those EBT cards for online purchases. So it doesn't pay for grocery delivery, but it does pay for the kind of drive it, order online, drive up and pick up kind of solutions. And right now, both Amazon and Walmart are the participating partners. We have dialogues with the feds about extending it, and I will tell you, it is a prohibition with the feds. I think the feds are comfortable with us opening that up right now, but right now it's a programming issue on the grocer side. So Hy-Vee has been fast and furiously working to try to reprogram. I think Target and some other online providers are doing the same, and so we just continue to have conversations with them around what that would look like. But we are supportive of the effort. It's really good.
Okay, thank you very much. One other question was whether or not you are aware of whether there are any state or federal dollars available to respond to the expected increase in homelessness due to the economic conditions caused by the pandemic. And if there are currently, what happens after those funds dry up? Because we suspect with all the individuals that are being out of the workforce now that we'll probably see an increase in that group of individuals.
Sure. So, I think that's a broader question than just the resources that flow in and through DHS. I think, we are working, like from a healthcare and insurer perspective, we are working to stand up a testing mechanism that will cover uninsured individuals' access to COVID-19 testing. For those individuals who seek medical care, our uncompensated care pool through Medicaid would kick in respective to any obligations that hospitals incur during this time. For the kind of broader, I certainly know I've been talking with Liz Cox a lot about what Polk County is doing respective to ensuring that there's a safe place for homeless individuals to go during this time. And so I think, as the state kind of looks at broader costs outside of healthcare delivery, I know it's on individuals' radar, and I think we're just going to have to look at that collectively. I do think, we've been having a lot of tough conversations around both increased cost and loss of revenue respective to healthcare providers. And one of the things that I know is difficult to hear, but it's something we all have to acknowledge. We've been having it on the child care side of things too. Like, we know that there will not be enough money to go around. And HHS, as we kind of talked about earlier in the conversation, they are making direct payments. And so what we're doing is really assessing where all of that revenue and funding streams are going, so that we can fill in the gaps as best appropriate during this time. And so we're going through a lot of very thoughtful exercises to make sure that we're understanding all of those very streams, and then what those embedded costs look like and/or loss of revenue.
So so my question would be, how are you involving county officials in those sort of discussions of identifying where the resources are and making sure that we can be helpful in and knowledgeable about where those resources are and how they might be used to fill in the gaps?
So it would be coming through your respective hospitals and or provider groups, because we host weekly calls with the Medicaid division of our agency around either changes in policy, practice, and or dialogues around specific issues respective to Medicaid. We also do that on the foster care side of things, on the behavioral health side of things. So there's just a variety of different ways that we're dialoguing. I don't have a particular group like specific to just local county officials, but we're happy to do that. dialogue right now around cost and what the experience looks like at the local level is really important to us, and we're trying to make a really conscientious effort to engage in those conversations. So I'm happy to set that up, and we can certainly talk offline about how best to do that.
Okay. Well, Director, I see him up on the 2 o'clock hour, and I don't want to keep you from your 2 o'clock call. So thank you for joining us, and we will be back in touch with you to make those connections. So please be safe and keep up the great work. Thank you.
Absolutely. Thank you. Thanks for the time today and letting me join into the conversation.
You're welcome.
Take care. Bye-bye.
So I want to just close this out. First of all, I want to thank all of our members for joining us today. As I mentioned earlier, we'll have a recording of this webinar available on our website either later today or early Monday morning. And you can find that website at www.iowacounties.org. Also, if you did not get an answer to your specific question today, please feel free to submit those to us, and we will put together a list of those questions, send them out to individuals that ask them specifically, but also in the next day or so, make them available on our website so that if anyone else is looking for an answer to those questions, you can find them there. I also want to mention that our association, in conjunction with the National Association of Counties, has been encouraging Congress and the President to provide resources directly to counties and cities to not only cover the additional costs that we might be incurring related to COVID-19, but also to fill in some revenue gaps that we anticipate we'll be having as a result of the economic downturn caused by the pandemic. I strongly encourage you to go to the NACO website, www.naco.org, to take a look at their information on the latest proposals that they have made to senators and representatives. And then it's really important that you, as county officials, reach out to our members of our federal congressional delegation and let them know about your role in public health, emergency management services, public safety, the provision of critical mental health services, and the other activities that you as county officials take part in. And finally, I just want to, again, thank you for all the work that you do every day to make our communities in Iowa safer during this challenging time. Please let us know how we can assist you. Don't give up, be safe, and we hope to see you soon. Thank you very much.